So, what's our experience? We did between October 2018 and December 2022. We treated 152 patients, and we put 291 MANTAs in. With the technical success we defined as placement of the MANTA closure device resulting in vascular closure without requiring immediately open or endovascular surgery. Major vascular complications were defined as bleeding, occlusion, dissection, stenosis, or embolizations requiring surgical interventions. In our hospital, we do the CTA within 6 weeks. So here you see the mean age of these patients was 74, the body mass index is 28, and the rest of the characteristics were as the same as you will expect in a patient with aneurysms. So most of them had single anticoagulant, 39 had a DOAC, 64 had the aspirin, and 42 had a clopidogrel. So we use the peripheral arterial calcium scoring system with grade 0 no visible calcification, grade 2 unilateral calcification more than 5 centimeters, and grade 4 bilateral calcification more than 5 centimeters. So in our population, our patients, 52% had grade 0, 36% at PAX grade 1, and only 0.7% at PAX grade 4. So the mean diameter of the common femoral artery was 10.5, and in 58% we used the 18 French MANTA device, and in 42% we used the 14 French. So this is where you can see the complications and failure to closure. It were 12 patients. One patient, that is case number 11, had failure on both sides. When you see the body mass index, it's around 25. The MANTA, the most were the 18 French that gave the problems. The diameter of the common femoral artery was minimum 8 millimeters. And like we said, the PAX score is 0, 1, and we had just one patient with a PAX grade of 3. All were on single anticoagulant, and time to reintervention, most of them was perioperatively, and you see 2 of the patients 2 days, and 1 patient at 4 months. All of the patients got an open surgery. So the intraoperative technical success was very high. It was 97%. The major vascular complications were 4.5%. 8 patients had a failure to close. 1 patient had an occlusion. 2 patients stenosis, and 2 patients had pseudoaneurysms. So post-operatively, we do a CTA. We saw only in 1 patient a stenosis in the common femoral artery. We see no dissections, no occlusions, or no pseudoaneurysms. So we conclude, ladies and gentlemen, the MANTA vascular closure device is a safe and feasible option with a high rate of technical success for percutaneous vascular closure of large bore holes in patients undergoing EVAR.